Welcome back. In our previous lesson, we talked about the need for adaptive, agile thinking in public health, but here's the thing, agility without structure is just chaos. Today, we're going to explore the PRECEDE-PROCEED framework. This model gives us the structure we need, while still allowing for the flexibility that complex systems demand. It's been the backbone of health promotion planning for decades, and for good reason. By the end of this lesson, you'll be able to accomplish three objectives. First, describe all 8 phases of the PRECEDE-PROCEED model and understand how they connect. Second, conduct what we call a social diagnosis. This is about understanding quality of life concerns from the community's perspective, not ours. And third, identify the predisposing, enabling, and reinforcing factors that affect health behaviors. These 3 categories are essential for understanding why people do what they do and how we can support behavior change. The PRECEDE-PROCEED framework was developed by Lawrence Green in the 1970s, and it's been refined over decades of application. PRECEDE is an acronym standing for Predisposing, Reinforcing, and Enabling Constructs in Educational Diagnosis and Evaluation. PROCEED stands for Policy, Regulatory, and Organizational Constructs in Educational and Environmental Development. Now, you don't need to memorize these acronyms. What you need to understand is the philosophy. This model is grounded in a simple but powerful principle. Begin with the end in mind. Start by understanding what quality of life means to the community, then work backward to understand what factors influence it. Let me walk you through the 8 phases. Phase 1 is social assessment, understanding quality of life from the community's perspective. Phase 2 is epidemiological assessment, identifying the health problems and their behavioral and environmental determinants. Phase 3 is educational and ecological assessment. This is where we examine those predisposing, enabling, and reinforcing factors. Phase 4 is administrative and policy assessment, determining what resources and organizational capacity we need. Phase 5 is implementation, actually delivering the program. And phases 6 through 8 are evaluation, process evaluation, impact evaluation, and outcome evaluation. Notice how the model begins with community concerns and ends with measuring whether we address them. Let's dive deeper into phase 1, the social assessment. This is where many planners make their first mistake. They start with the health problem, high rates of diabetes, low vaccination coverage, whatever it is. But PRECEDE-PROCEED asks us to start differently. Start with the community's definition of quality of life, what matters most to them, and here's the key. It might not be health at all. A community might be most concerned about employment or safety or maintaining social connections. Health might be way down the list. By starting here, we understand the context, we build trust, and we position health interventions within what the community actually cares about. In phase 2, we conduct an epidemiological assessment. Now we're looking at health problems, but through the lens of what we learned in phase 1, which health issues are most affecting the quality of life concerns we identified. Then we dig deeper. What behavioral factors contribute to these health problems? What are people doing or not doing that affects their health? And just as importantly, what environmental factors play a role? What physical, social, or economic conditions shape these behaviors? We prioritize based on 3 criteria: importance, how significant is the impact; changeability, can we actually influence this; and resources, do we have what we need to address it? Phase 3 is the educational and ecological assessment, and this is where the model really shines. We examine 3 categories of factors. Predisposing factors are the cognitive and emotional precursors to behavior. What do people know? What do they believe? What are their attitudes? Do they feel confident they can change? Enabling factors are what make behavior possible or impossible. Does the person have the skills? Are resources available? Is the healthy option accessible? You can have all the motivation in the world, but if the healthy choice isn't available, it won't happen. And reinforcing factors are what sustain behavior over time. What rewards do people receive? What feedback? What social support? These 3 categories. Predisposing, enabling, reinforcing give us a complete picture of why behavior happens or doesn't happen. Phase 4 is the administrative and policy assessment. This is the reality check. We've identified what needs to change. Now we ask whether we can actually do it. What organizational capacity do we have? What resources? Are there policies that will support our intervention or hinder it? What's our budget, our staffing, our timeline? This phase prevents us from designing beautiful programs that can never be implemented. It forces us to align our aspirations with our actual capabilities. And sometimes, the honest answer is that we can't do what we initially hoped. That's valuable information. It's better to know now than after we've launched. The remaining phases are about doing and measuring. Phase 5 is implementation, actually delivering the program you've designed. Phase 6 is process evaluation. Was the program delivered as intended? Did we reach the people we meant to reach? Did we do what we said we would do? Phase 7 is impact evaluation. Did those predisposing, enabling, and reinforcing factors change? Did knowledge increase? Did access improve? Did social support strengthen? And phase 8 is outcome evaluation, the ultimate question. Did health improve? Did quality of life improve? Notice how this brings us full circle, back to what we assessed in phase 1. Now here's where we connect back to our previous lesson about agile thinking. The precede-proceed phases are iterative, not strictly linear. As you gather new information, you may need to revisit earlier phases. Maybe your epidemiological assessment reveals something that changes your understanding of quality of life concerns. Maybe your enabling factors assessment shows that your original behavioral target isn't feasible. That's okay. The framework provides structure without rigidity. And here's a practical tip. Adapt the depth of each phase to your context and resources. A small community program doesn't need the same level of analysis as a national initiative. Use the framework as a guide, not a straitjacket. Let's summarize the key takeaways. PRECEDE-PROCEED begins with community quality of life, not health problems. This grounds our work in what actually matters to people. The model works backward from desired outcomes to identify what needs to change, ensuring logical connections throughout. The three categories of factors, predisposing, enabling, and reinforcing, give us a complete picture of behavior. Administrative assessment ensures that our programs are actually feasible given our resources and context, and evaluation connects back to the original social assessment, completing the circle. In our next lesson, we'll explore social determinants and equity analysis, examining the structural factors that shape health outcomes. Thank you for your engagement today.